Taking care of your health is an ongoing journey, and for women, that journey includes important health screenings that can make a tremendous difference in long-term well-being. Screenings are more than just routine checkups. They are proactive measures that can help detect potential health concerns early, when they're often most treatable. Yet, with busy schedules and competing priorities, it can be tempting to postpone or even skip these crucial appointments. However, understanding which screenings are essential and why can empower you to make informed decisions for your health at every stage of life. Let's begin with cervical cancer screening, one of the most impactful preventive measures for women. The Pap test, or Pap smear, is designed to detect abnormal cells in the cervix that could develop into cancer. Women should typically start Pap tests at age 21 and continue every 3 years if results remain normal. After the age of 30, the test can be combined with HPV screening, extending the interval to every 5 years in many cases. These simple tests are proven to reduce the risk of cervical cancer dramatically, and skipping them can allow silent changes to go undetected for years. Next, there's breast cancer screening, which most often involves mammograms. Breast cancer is the most common cancer among women worldwide, but when caught early, survival rates are high. It's generally recommended that women begin annual or biennial mammograms by age 40, though those with a family history or genetic risk factors may need to start earlier. Mammograms can identify tumors that are too small to be felt, giving women the best chance at effective treatment. Skipping mammograms means missing the opportunity to catch cancer before it spreads. Another vital screening is for colorectal cancer. Though often associated with older adults, colon cancer is increasingly being diagnosed at younger ages. For women at average risk, screening typically begins at age 45. This may involve a colonoscopy, stool tests, or other methods. Colonoscopies are unique in that they can find and remove precancerous polyps during the same procedure. By keeping up with these screenings, you can prevent cancer from developing in the first place. Bone health is another area where screenings play a key role, especially as women approach menopause. Osteoporosis, a condition that weakens bones, affects millions of women and increases the risk of fractures. A bone density test, called a DEXA scan, is recommended for women aged 65 and older, or younger, if there are risk factors such as family history, low body weight, or previous fractures. Early detection allows for interventions that can strengthen bones and reduce the likelihood of debilitating breaks. Heart disease is the leading cause of death for women, yet many underestimate their risk. Routine screenings for blood pressure, cholesterol, and blood sugar are essential in identifying risk factors before symptoms appear. High blood pressure, high cholesterol, and diabetes often have no obvious signs, but they can quietly damage arteries over time. By monitoring these numbers regularly, you and your healthcare provider can make lifestyle or medication adjustments to protect your heart health. Sexually transmitted infection, STI screenings, are also important regardless of relationship status or age. Some infections, such as chlamydia and gonorrhea, can cause long-term health issues like infertility if left untreated, yet may have no symptoms. Regular screenings, especially for sexually active women under 25 or those with new or multiple partners, can ensure early treatment and prevent complications. Diabetes screening is another step not to be missed. The risk of developing type 2 diabetes increases with age, weight gain, or family history. A simple blood test can detect prediabetes and diabetes, allowing for early interventions that can help avoid serious complications like heart disease, kidney failure, and vision loss. For pregnant women, gestational diabetes screening is also critical, as untreated cases can impact both mother and baby. Thyroid health is often overlooked, but thyroid disorders are significantly more common in women than men. Symptoms like fatigue, weight changes, or mood swings can be subtle or mistaken for other issues. A thyroid function test is a straightforward blood test that can uncover underactive or overactive thyroid conditions, both of which are treatable when caught early. Vision and hearing screenings are also important, especially as women age. Regular eye exams can detect changes in vision, as well as eye diseases such as glaucoma and macular degeneration. These conditions, if caught early, can often be managed to preserve sight. Hearing tests are also recommended, as gradual hearing loss can impact communication, safety, and quality of life. Skin cancer screenings should not be overlooked, particularly for women who spend significant time outdoors or have a history of sunburns. A full-body skin exam by a dermatologist can identify suspicious moles or spots that could be early signs of skin cancer, including the deadly melanoma. Self-exams are helpful, but professional screenings ensure nothing is missed. Immunizations are another key aspect of preventive health. While not a screening, staying up to date on vaccines like the flu shot, HPV vaccine, and, for older women, the shingles and pneumonia vaccines helps protect against serious illnesses that can have lasting effects. Mental health screenings are equally important. Women are at higher risk for conditions like depression and anxiety, yet stigma or lack of time can prevent seeking help. Routine mental health check-ins with a healthcare provider can identify concerns early, connect you with resources, and support overall well-being. It's important to remember that the recommendations for these screenings can vary based on personal history, family history, lifestyle, and other risk factors. That's why building a relationship with a trusted healthcare provider is so valuable. They can help tailor a screening schedule that's right for you, answer your questions, and address any concerns. Many health issues develop silently, without obvious symptoms. That's why regular screenings are one of the most effective ways to protect your health. By staying proactive, you're not just looking out for yourself, you're investing in your ability to care for your loved ones and enjoy life to the fullest. If you're overdue for any of these screenings, or if you're unsure which ones you need, reach out to your healthcare provider and make an appointment. These tests are not just routine, they are life-saving tools. Prioritizing them is an act of self-care that pays dividends for years to come. Take charge of your health today. Don't let a busy schedule, fear, or uncertainty keep you from getting the screenings you need. Your future self will thank you.